Welcome to Kaplan Brain Health, and we're going to ask, should I use a daily aspirin? It's actually a difficult decision.
Latka, go.
Let's follow Latka to see what she decides. If she makes a left, it's don't use aspirin. A right, it's do use. Is she going to make a left? Let's take a look. Oh, she made a left. Well, the primary risk is major bleeding. That's what we have to worry. Over a 10-year period, aspirin confers a 50% increased risk of non-fatal bleeding outside the brain. Oh my God, that's pretty bad. We have to be careful. Aspirin, 100 milligrams or less, creates a 58% increased major bleeding risk. Oh my God, that's terrible. Low-dose aspirin for the primary prevention remains controversial. Oh, not to me. Low-dose aspirin increases the risk of intracranial extradural, which means outside the brain, hemorrhage. Whew. God. Let's follow Latka and see what she says. Assessing the potential benefits and reducing the risk of myocardial infarction or colon cancer actually does occur with using aspirin, so it has to be individualized whether you use it or not. But there are risks. Look online. There is a cardiovascular disease risk calculator which will help you and your physician make that decision. It's a tough decision, and we're almost at the end of this course. High-risk individuals are more likely to benefit from long-term aspirin if they are not prone to bleeding, but that's hard to determine for a lot of us. You know, we may have aneurysms in our brain, we may have bleeding risks that we just don't even realize as we get older can develop. Anticoagulants and non-steroidal anti-inflammatories are common, and they increase bleeding risk and will reduce your net benefit if you do take aspirin. It's true that people with a history of heart attacks or coronary vessel disease or survivors may have reductions in future events if they take an aspirin, so you have a tough decision. But the benefits and harm are closely balanced in healthy people. So have you had a heart attack or a stroke? These are things to consider. Use a risk calculator. They'll help you determine your risk-benefit ratio, and then you can discuss that with your physician, as a small aspirin isn't necessarily harmless. In the hospital, we do use aspirin for short courses after a person has a stroke with reduced blood flow or an ischemic event. It can help recovery, but even then, it's only for short courses in some people. Aspirin was once routinely recommended by many physicians in the community, and now there's close considerations we have to think about. Talk to your physician before starting long-term aspirin. Use a risk calculator which considers your age, bleeding risk, and don't forget about the modifiable risk factors that you can help reduce your risk of stroke even without an aspirin, like exercise. Things to consider are very important, but Latka and I are very tired and we're almost home, so we'll probably be ending the video soon. Consider your blood pressure though. Don't forget about diabetes, even pre-diabetes. Stop smoking. Lower your fat intake and your lipids, and consider increasing your physical activity. Take your dog for a walk. Go for a bike ride. Do whatever you can. It was once thought that an aspirin a day keeps the doctor away. Well, that's not necessarily the case at all, as we've learned today on our little stroll through Hamilton Lake area. Good night, and thank you for subscribing and watching this video, and don't forget, be a subscriber to Kaplan Brain Health. Both Latka and I will appreciate it.